Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today I invite back my good friend, Julie Tupler, to speak again on the subject that she is so passionate about, healing diastasis recti. And what's so fascinating is that I connected with Julie just 2 years ago and invited her to come on my podcast then so that my audience could learn more about this very underdiagnosed condition of the separation of the abdominal muscles that's very, very common during pregnancy and postpartum, so that women can learn about it, learn how to identify it, and also learn that there's a non-surgical treatment for it. So here we are 2 years later, and I went through her program and healed my own diastasis. I'm almost completed with that process. And, want to just bring more awareness how beyond following her program to close your diastasis, how workouts and exercise can either positively or negatively impact a diastasis as well. So let's talk a little bit about Julie and who she is and what she does. Julie Tupler is a registered nurse, certified childbirth educator, and a certified personal trainer. She developed a maternal fitness program in 1990 and has over 30 years experience of teaching and developing the Tupler Technique Program for women during and after pregnancy. In 2009, she opened Diastasis Rehab to specialize in the treatment of diastasis recti for women, men, and children. Dr. Oz calls Julie an expert on diastasis recti, and Elle Macpherson credits the Tupler technique for a 20-minute delivery in her fast recovery. The Tupler technique, a research and evidence-based program to treat a diastasis recti, has now been translated into 6 different languages, and Julie trains medical and fitness professionals all over the world in her proprietary program. She's also written 3 best-selling books, Maternal Fitness, Lose Your Mummy Tummy, and her recent book, Together Tummy. She's produced 5 videos on diastasis and invented the Diastasis Rehab Splint, Diastometer for measuring a diastasis, Corrective Connective tissue cream, and TogetherTape. Julie has developed an 18-week ongoing online support program for her clients all over the world. She is on the advisory board of Fit Pregnancy, Women's Health Foundation, and the Women's Sports Foundation, as well as Medical Fitness Network. She's a frequent speaker at medical and fitness conferences, including the American Hernia Society, as well as speaking on using her Tupler technique approach before abdominal surgery to prevent incisional hernia. Her website is diastasisrehab.com. Hello, Julie. Welcome back to Well-Adjusted Mama for round 2. Thanks for joining us today.
Glad to be here. I'm always glad to talk about diastasis and bring an awareness to this condition that most people don't even know that they have.
I understand. It's like such a, it's so bizarre to me that this is like such a common condition where you have that separation of the abdominal muscles. This is men, women, children can all have this diastasis recti, and they don't know about it. Or, especially women who are pregnant or have just given birth, there might be some awareness that this could happen. But then if they get checked, they might be getting checked incorrectly. And regardless, they're told the only way to heal it is through surgery. So I want you to spend a little time today just to really help clear up some of those myths that are out there, specifically for our pregnant and new moms listening.
Okay, I'm, of course, glad to do that.
So let's start off with what is diastasis recti and how's the correct way to check for one?
Okay, so a diastasis recti is a separation of those outermost recti muscles, or those 6-pack muscles, all right? And in between the muscles is some connective tissue. And when the connective tissue stretches sideways for various reasons, all right, and the muscles then separate, the muscles are not doing their job of supporting your body, supporting the front, the back, the top, and the bottom. So the side effects then are, for the front of the body, every time you eat, you might get bloating after eating, constipation. Your organs are out of alignment when the muscles aren't there to support them. And then umbilical hernia is another condition that is a side effect of a diastasis, poor posture, back and hip pain, pelvic floor issues. When the muscles separate, it can put a pregnant woman at risk for a C-section, because if this is the uterus and this is the cervix needs to be lined up with the vaginal canal. When the muscles separate, the top of the uterus tilts forward, so now the cervix is pointing sideways instead of downwards. A diastasis can also put a patient having abdominal surgery at risk for an incisional hernia, which means that the stitches come undone after the surgery. So this condition is something that not only causes a bulging belly that most people don't like and think that that they either have to diet or they have to do crunches or they have to have surgery. So bringing the muscles together is really important. And you can do this by strengthening that connective tissue between the separated muscles. So it's then strong enough to hold the muscles in a close together position. And once you strengthen it, you see your belly button going from an outie to an innie, your back pain disappearing, your posture is better. So all these things can clear up. So the point is to strengthen that connective tissue between the separated muscles. And my program does it 3 ways. Number 1, continuously repositioning the muscles and the connective tissue, putting them both in a close together position, because that's the position they're supposed to be in. Okay? Strengthening the muscles and the connective tissue with my Tupler Technique exercises, and learning how to use your abdominals, developing that awareness of how to use this innermost transverse muscle that controls that outermost muscle, learning how to use it with activities of daily living and when you work out, so that you're not stretching your connective tissue. Because remember, the whole point is to make it stronger. If you keep stretching it, then it's not, that connective tissue is not going to, to heal. Yeah. So those are the 3 ways that you need to do that. And if you have surgery, they cut you from, it sounds like a tummy tuck. It sounds like a little nothing surgery, but they cut you from hip bone to hip bone and they lift up the skin, and then they, bring the connective tissue together and then stitch it, and then bring the skin down, and and so it's just stitching. So if the patient does not know how to use their abdominals in the recovery process, every time they stand up, because they tell you after surgery, don't lift anything over 5 pounds. So when you're lifting your whole body weight, every time you do that, if you haven't developed a strong transverse muscle and know how to use it in the recovery process, then what's going to happen is you're going to be putting force on the stitches every time you move on that stitch connective tissue. And then I've seen many clients have come to me and their tummy tucks have come undone. And it's really a horrible surgery. They put drains in you. It takes a while to recover from it. And then you have this horrific scar from hip bone to hip bone that has to be mobilized. Because when you have a scar, it gets stuck together, and the layers of connective tissue need to glide over each other. When there's a stuckness, then there's pain, and it's going to be harder to reposition the connective tissue if there's a stuckness there. So I always advise clients, if they're thinking of having surgery, to do my program first, because it's a win-win situation. Because number 1, they might not need the surgery after they do my program. And number 2, if they do end up needing the surgery, the muscles will be closer together, meaning they probably won't need the mesh. The connective tissue will be stronger, so it'll hold the stitches better. And the client will know how to use their abdominals in the recovery process to maintain the integrity of the sutures. So,
yeah, like we had these mommy makeovers, right? After a woman's had her last child, she's like, I want the breast lift. I want my belly sewn back together, fix me, doctor, right? And it's It's very passive, and it is very invasive, and it's a very traumatic to the body to have that type of surgery done. So I think that's something that, I really want women to understand. And, going to the gym and doing your regular workouts might actually be making the bulging belly worse, right? So
Yes, absolutely. When I go to the gym, I have to go like this. I see these people paying trainers to do stuff that's just like that's separating their muscles and bad on the discs of their spine. So the one thing is that people have to stop doing crunches because it is physically impossible to engage that innermost muscle, right, when the shoulders come off the floor. So in my program, we do a head lift instead of a crunch. And that way you're able to engage the transverse muscle. You don't want to be doing any exercises where you're stretching your connective tissue. So if you're arching your back, that's stretching the connective tissue. So you have to, watch the position of your back. You don't want to be doing hands and knees with the diastasis because all the weight of the organs stretches that connective tissue, and it's very difficult to engage this innermost muscle. So the rule of thumb is I need to be able to engage this innermost muscle, thinking about bringing my belly button to my inner spine. If I can't do that, then the muscles are moving in the wrong direction and it's stretching the connective tissue. And remember, the whole program is about strengthening the connective tissue. And if you keep on stretching it, it's not going to get stronger. It's going to get weaker. Exactly. Right. It's going to get weaker. So
I want you to talk a little bit about in your program how you bring the muscles and the connective tissue together in that narrow position and why that's so important, because I think there's some even diastasis programs out there, other ones, right, where they have transverse exercises, but there's no splints.
Okay. So this is really important. If your diastasis is 4 fingers apart or more, what happens is the muscles, when we look at them under ultrasound, the muscles move side to side. Okay, so this side-to-side movement is not strengthening the muscles, okay, and it's actually stretching the connective tissue, this sideward movement. So you must reposition the muscles and the connective tissue with a diastasis rehab splint. Then we do double splinting. We do the taping. We have several methods, but the most important one is wearing a splint to bring the muscles and the connective tissue together and continuously wearing it. Just like if you broke your arm, you would wear a cast continuously so that the two ends of the bone would fuse. So this is the same thing. And a lot of times people say, well, it weakens the muscles. No, it doesn't weaken the muscles. It's just repositioning the muscles closer together. It's not compression, it's approximation. Okay. And then some people think just wearing the splint, putting it in the right position. All right. That's not enough either. You need to do the exercises, and the muscles, to get stronger, need to move in a front to back direction. If they're moving side to side, they're not going to be getting strong, and it's weakening the connective tissue. So you're not going to get results unless you approximate the muscles and the connective tissue. You're just not going to do it. That came to me many, 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 many years ago when I was teaching maternal fitness, working with women during and after pregnancy, preparing them for the marathon of labor. One of the physical therapists that was doing it had a huge diastasis. When she came up, you could see this big doming. And when she was doing the transverse muscle exercises, she said, "Julie, I can't feel my muscles working." So I thought, So I took a scarf and I had her hold the scarf and pull the muscles together. And then all of a sudden she felt them working. So that was a light bulb moment for me to understand that the muscles have to be close together to move front to back. Okay. So that's very important. So the program is 4 steps: is repositioning, doing the exercises, getting the awareness of the transverse so that you use your muscles with activities of daily living and when you work out, and then getting up and down correctly. And the getting up and down correctly is important because, and I could have put that with using your abdominal muscles with activities of daily living, because getting up and down is part of daily living. But on a forward forceful movement scale, if I stand up, it's my whole body weight. If I'm not engaging my transverse, it's going forward and stretching the connective tissue with all the force of my whole body weight. All right. And the same thing with getting up and getting down. I had a woman, I had just a client that we had just about closed her diastasis, and she got up and she jackknifed, and I almost had a heart attack. So I got her back down to check her, and she had opened it up with just one jackknife. Okay. So getting up and getting down is very important as well.
Yeah.
Right?
And if you're doing all this work to get closed,
that it has to be all inclusive, where where your transverse muscle is your best friend. All right. That you need to know if it's in or if it's out. Okay. With everything you do, because you use your abdominals with every breath you take and with every move you make. So if you're not aware of how to use it correctly, then they're going to be going forward, stretching the connective tissue, or going sideways, stretching the connective tissue. So that's why it's important in the first 6 weeks of my program to start using your innermost transverse muscle with activities of daily living. And then in week 6, we do a diastasis safe workout. Once they've strengthened the transverse muscle and are strong enough to use it with every repetition of every exercise. And this diastasis safe workout is important because in 6 weeks, they may have just made their diastasis 55% smaller. That's what my statistics show, that in 6 weeks, you can make it 55% smaller. So then a diastasis safe workout is to, number one, maintain the gains that you've made during the first 6 weeks at 55%, continue to close it, and then once you close it, to keep it closed. So for me, I'll be doing a diastasis safe workout the rest of my life, because it's really, and I've been a trainer since the mid 80s, so it's really the best way to work out is where all the power comes from the core. So my abdominals are lifting my arms, my abdominals are straightening my legs, my abdominals are lifting my head in the head lift. It's really the best way to work out is to use this innermost transverse muscle.
It's our power center, and it's our power center physically for moving our body. I had a patient actually who saw a physical therapist who said, yep, you got a diastasis. And she said, and I love this word, you're leaking power. And this is someone who's very active, fit, had her 6-pack, right? But it was over here, it was separated, and, took a lot of pride in her fitness. And was very like, that's not okay. I don't want to be leaking power. So there's that physical leak of power. And then we can also say that because our third chakra is in our middle, like by our belly button, under our belly button or in front, that's our power energetically as well, right? So there's all these power coming from our middle that we don't want to leak. We don't want to be leaking power.
I like that too.
Yeah, isn't that great? So, I think the other thing too, I see with moms, it's like, oh, every time I lift my baby who's now 20 pounds, my back hurts, right? Because, as new moms, there is a lot of physicality that's required to take care of a baby and a home. And not to mention, like, they're probably wanting to get back to working out and strength training and whatnot. And you can't do that if your core is separated as effectively, or you're going to feel the side effects. You're going to feel weak.
Absolutely.
And have injury. So this is, the inspiration I want to bring today to women listening is that this is, number one, fixable. It does not require surgery. It does require a commitment to wearing the splints all the time. Like Julie mentioned, it requires doing the transverse exercises 3 times a day. And it requires being conscious of how you move your body, getting up and down, lifting your baby, getting out of bed, all of these things. We want to be conscious.
And breathing correctly, because if you breathe in opposition, even that is an issue. So we teach people how to do belly breathing. So they're using the muscles. So when you take a belly breath and you expand your belly with air, you see the belly going forward passively. And then you exhale and you use your abdominals to bring the belly back to the spine. Most people breathe in opposition. They inhale, they hear that nasty word inhale, and they bring their abdominals back. And when they exhale, it goes forward and puts force on the connective tissue. And when you breathe that way, you're only using the top part of the lungs as well. So you can lose the elasticity in the bottom part of the lungs. And oxygen is the best thing you can do for your body. So belly breathing is not only good for your connective tissue, but it's really, good for your body. So in the first 6 weeks of the program, when we're just doing cardio, there's no exercises until you have developed transverse strength and awareness. But the cardio, every time you're walking outside, you're expanding the belly, it goes forward, and exhaling and bringing the belly back to the inner spine. To learn how to breathe that way is really important. You see new babies breathe that way, but somehow we start breathing in opposition, and that's a problem.
It is
on many levels.
Thank you for mentioning that, because I do find that this is a conversation I have with every single adult in my practice. We get into what I call stress breathing, or that breathing in opposition, and we're poorly oxygenating our body, which is going to not only impact our healing, but it's going to impact brain function. It's going to impact our energy. It's going to impact our ability to think clearly and do what we want to do, right? Get our list done and have and get it done in an efficient and effective way. And also just getting the toxins out, right? The CO2. So belly breathing, which is the natural state and the healthy way to breathe, is when air comes in through the nose, the belly expands and with air and fills the air balloons of the lungs up fully with oxygen. And then when we exhale, the belly comes in, pushing the carbon dioxide out.
So it's another opportunity to use the transverse muscle, because you could exhale and just go like this, or you can use your transverse to take the air out and bring the belly back to the spine on the exhale of every breath.
Right.
So in developing transverse awareness, it's important to do that. And we do that in the first 6 weeks using, the transverse muscle. Before I stand up, I bring the belly button back to my inner spine and then stand up. Before I sneeze, before I cough, when I go to the bathroom, when I stand up, when I sit down, I'm engaging. Because if I don't engage this innermost transverse muscle, it's going forward and stretching the connective tissue. And if it keeps on getting stretched, the connective tissue is not going to heal. So developing this awareness of how to use the transverse muscle during the first 6 weeks is important, and doing the exercises to strengthen them. Once we've strengthened them in week 6, then we can do this diastasis safe workout. Now, people never, ever want to do crunches because it's physically impossible to engage the transverse in a back-lying position when the shoulders are off the floor. That's why we do a head lift. If we have a diastasis, we don't want to do hands, any abdominal facing down, because then all the weight of the organs is stretching the connective tissue. So if we wanted to do planks, we could do the plank standing or the push-up standing against the wall.
What if the diastasis is closed?
If the diastasis is closed, then you can do the abdominal facing down position, but you have to continue to be working the transverse. With every repetition, you're doing that little squeeze, using that transverse on the work part of every repetition of every exercise. So if I'm doing a military press, okay, I get in the right position, my head is back, my ribs are in, my transverse is in at my spine, which I call fifth floor. So this is the starting position. So now I'm at my inner spine. So now on the work part, which is straightening my arms, all right, I'm going to do that little squeeze with my abdominals. I'm going to squeeze the abdominals and say 1, and then I'm going to stay at my inner spine. I'm going to squeeze it, thinking about it going out the back of my spine, and then stay here. Okay, so with every repetition of every exercise, we're using this now strengthened transverse muscle that's been strengthened in week 6.
Right. And it's going to help, like you said earlier, help you move your arms, move your legs, do the full body.
Well, it's going to be the power. It's going to be the force. All right. It's going to be the force that you think of your transverse muscle straightening the arms in a squat. And you go down, you stay, you keep it at the inner spine, and then you come up. You think about it going out the back of your spine. So on the work part of the exercise, which is going against gravity, you want to make sure that you're using it with every repetition of every exercise.
Right. And that is what a diastasis safe workout is. So you're getting that additional abdominal workout in, right? While you're strengthening your arms.
And while you're protecting that connective tissue, you're strengthening the muscles by doing the little exercise and protecting the connective tissue because it's very easy, because you have a weak spot at your belly button in the connective tissue. It's very easy to open up. If I started doing crunches, I could create a diastasis on myself.
Right. Anyone could.
Right.
So that's so important. And I mean, I think there's so many people that's like a fundamental part of their, core exercise or abdominal exercise is crunches, right? Or sit-ups.
And they do it as part of, when my daughter was going to grammar school, they were doing it as part of the fitness gram, having them do that. And I said, my daughter can't do it. She has separated muscles. She has a diastasis. She can't do that. So I saved her from that.
But all those other poor kids, like we were
all those
doing
other poor kids.
The presidential challenge, right? This is back in the 80s with Reagan. It's like, okay, how many sit-ups can you do? All these other little fitness things that they were measuring in elementary school.
And sadly, people want to hold on to that the crunches. It's just they want to hold on to that for some reason.
Yeah, I don't know why. Yeah, it's interesting. It's like,
I don't either. But it's I'm finding that some of the health practitioners are saying don't do crunches. So I'm happy to hear that. They're saying if you have a diastasis, don't do it. What they should be saying is you shouldn't do it whether you have a diastasis or don't have a diastasis, because if you don't have a diastasis, you're going to create the diastasis by doing that.
Right. Exactly. And I would say like pretty much 99% of women right after they've given birth have a diastasis. Would you agree with that?
I would absolutely agree with that. And it's very interesting because when I was teaching maternal fitness way back when, and we would check the diastasis, the people that had done crunches had a bigger diastasis during their pregnancy than the people that didn't do them. Right?
That is crazy. And they were doing it to have this strong core to push this baby out, right? Be more effective with the birth. And it could have actually backfired. So to your point, even like I met a personal trainer recently who had a breech baby and had 2 cesareans, and she has a severe diastasis, right? From years and years of crunches and other exercise that actually could have been the reason why she needed C-sections.
And it's so important to know what I learned, having been at many births, that women are told to hold their breath and bear down. And I was teaching exhale pushing, and I had to rethink my teaching, because if they're told to hold their breath and bear down, and they're not able to exhale, it wasn't about the exhale breathing, but the most important thing is, when you're pushing in labor, is to engage the transverse, okay? Because if you engage the transverse and do Valsalva, you still don't feel anything in your pelvic floor. But what I teach for pregnant women is how to push with the abdominals and relax the pelvic floor. So the most important thing in pushing is having that transverse strength and awareness, having a smaller diastasis so the uterus is in the right place, and knowing how to push with the abdominals and relax the pelvic floor.
That is huge, by the way, because especially as women, before pregnancy, especially, we're taught with the Kegels, right? And it's like, you bring it all in and you're lifting up, but during labor and delivery, it is about the opening, right? And
it's because what's natural to do is tighten the abdominals and tighten the pelvic floor. So this skill of learning how to tighten the abdominals and relax the pelvic floor is something that you can't teach somebody in labor.
No.
It takes at least 21 days to learn a new skill. So I would say to my clients, now, who are you thinking about when you're going to the bathroom? I hope you're thinking about me, because I get a lot of job satisfaction knowing that you're thinking about me. But when you go to the bathroom, it's a good time to practice going back when they're having a bowel movement, going back with the abdominals and relaxing the pelvic floor, and also get in touch with, right before they urinate, that opening, because that's that opening or relaxing the pelvic floor to get that awareness of what that is. So in the classes, when I would be doing abdominals, I'd always say relax the pelvic floor. When I'm doing the pelvic floor, I would say relax the abdominals, so they learn how to use them in opposition. When they get to the birth, they can push with their abdominals, relax the pelvic floor.
Right. That's very important.
And childbirth educators, sadly, don't teach this. This is not, I'm a childbirth educator, and this was not taught in childbirth education.
So now that a woman's given birth and she's now wanting to not only strengthen her, heal her diastasis, but also strengthen her pelvic floor that could be stretched and weakened. Now she's contracting them both together, correct?
Well, it's important for the birth to be able to strengthen the pelvic floor, because a toned muscle stretches back behind the baby's head. But you need to strengthen it and also learn how to relax it. That's important.
So how do women do that?
How do women strengthen the pelvic floor?
And practice relaxing it for birth.
Okay, so when they go to the bathroom or in the class, if I'm working the abdominals, I'll tell them to relax the pelvic floor. If I'm working the pelvic floor, I'll tell them to relax the abdominals, so that they know how to work them separately. And they can practice doing this also when they're going to the bathroom. When they're having a bowel movement, they can bring their abdominals back and think of opening. And right before they urinate, think of that opening, so that they know what that relaxing is, not tightening it.
Right, like a flower.
Like a flower. That's it. At the end of a pelvic floor exercise, I would always say, open up like a little flower and close it in, so that they get that visual image of those muscles doing that.
And that will help then also like minimize incontinence and other.
Of course. If you know how to relax the pelvic floor, and are engaging your abdominals, you're not going to be pulling on the ligaments of the uterus and having a prolapsed uterus. You're not going to be having hemorrhoids, and you're not going to be having that incontinence. All right. So it's really important. So pushing, it's really important to have a strong, transverse muscle, have the abdominal muscles be close together, and know how to push with the abdominals and relax the pelvic floor. So that's the secret for having a great birth.
Right. And it just blows my mind that this is not part of childbirth education. Like, childbirth is not easy. So how can we help support women and making it as effective and efficient as possible? You got to get in front of the
That's
childbirth educators too.
yes, I do. I have a video called Perfect Pushing. So that's,
Right. So women can go to your website, diastasisrehab.com, and check out perfect pushing during their pregnancy to help prepare for labor.
and then there's the Lose Your Mummy Tummy for afterwards. There's the belly button boogie for children. It's always great for the mom and dad to be doing the exercises with the child. So have it make it a family affair there, because men have a diastasis as well. So we have the Say Goodbye to Your Gut Guy for the men, and then the Ab Rehab for preparing for abdominal surgery.
Right. So all this population, they're learning essentially the same techniques, right? The same skills. And it's just like the steps you went over earlier.
Right. And in my Together Tummy book, it talks about all of that. It summarizes everything. So that's another way to, if you like to read, to learn about it.
All right. Any last thoughts you want to share with the audience?
Any last thoughts? If you're doing crunches, please reconsider that, because it's very bad for the disc of your spine and also for your belly. And if you're considering having surgery, think about doing my program first, because after you do my program, you might not need the surgery. And if you do end up needing it, you will be much better prepared for it.
Right.
And because the muscles will be closer together, the connective tissue will be stronger, and you'll know how to use your abdominals in the recovery process to maintain the integrity of the suture. So if you're thinking about having abdominal surgery, definitely do my program first.
Right. And even back surgery. Right.
Same thing. Because when you engage this transverse muscle, this innermost transverse muscle, comes all the way around your body. It's like such a great muscle, comes all the way around. It inserts into each side of your spine and then comes around and goes behind and in front of that outermost recti muscle. So when you engage this muscle, when you're doing these exercises, you get like, you work all these other muscles at the same time. You get the recti muscle, you get lumbar multifidus in the back, you get diaphragm, you get pelvic floor, just with working this transverse muscle. So this is really the most important muscle in your body to strengthen, is this transverse muscle.
Right. Wonderful. Well, thank you for bringing your passion and your enthusiasm to this topic, and, empowering women that there is something they can do to get rid of their bulging belly, to feel strong, and to stop leaking power.
And thank you so much for inviting me, because as you know, I'm always, interested in talking about this.
Well, I hope you learned that you never, ever, ever, ever should do a crunch again for the rest of your life, and really recognizing how important it is to have your core strong to really address the instability that occurs when the muscles are separated with the diastasis recti, and how it is possible to heal, the hope, and surgery is not required, and you can lose that bulging belly. So thanks for listening, and look forward to seeing you in the next episode.